Hey everyone, welcome back to the channel. If you're considering a hair transplant, you're definitely not alone. This procedure has become a popular solution for people dealing with hair loss or thinning. Whether you're facing male pattern baldness, female pattern hair thinning, or other types of hair loss, a hair transplant can offer a permanent solution to restore your confidence. But before you take the leap, there are a few important things you need to know to make sure you're making an informed decision. Let's dive into everything you need to consider before going for a hair transplant. Hair transplant procedures typically fall into two main categories: FUT, Follicular Unit Transplantation, and FUE, Follicular Unit Extraction. In FUT, a strip of skin with hair follicles is removed from the donor area, usually the back or sides of the head, which is then divided into smaller grafts and transplanted to the thinning or balding areas. On the other hand, FUE involves extracting individual hair follicles directly from the donor area and placing them into the recipient area. While FUT can leave a linear scar, FUE results in tiny, more discrete scars. Many patients prefer FUE for its less noticeable scarring, but both methods are effective. The ideal candidates for a hair transplant are those with a stable pattern of hair loss and enough donor hair to work with. It's typically recommended for individuals over the age of 25, as hair loss patterns become more predictable by then. In addition to having sufficient donor hair, it's essential to be in good overall health, as certain medical conditions can impair healing or affect the success of the procedure. Before undergoing the procedure, you'll have an initial consultation with a hair transplant specialist. This consultation is your opportunity to discuss your expectations and ask questions about the process. Your surgeon will evaluate your hair loss pattern, determine if you're a good candidate, and suggest the best technique for your situation. If you decide to move forward, you may need to adjust your medication, particularly blood thinners, and refrain from smoking or drinking alcohol in the days leading up to the surgery, as these can impact the healing process. On the day of the procedure, the surgery is performed under local anesthesia, so you'll be awake but won't feel any pain. The process can take several hours, depending on how many grafts need to be transplanted. During the surgery, hair follicles are carefully relocated to areas where hair is thinning or absent, and the procedure is minimally invasive. While the operation itself is relatively painless, you may experience some discomfort, swelling, or redness in the days following the procedure. Recovery from a hair transplant is usually quick, but you'll need to follow post-operative care instructions carefully. It's common for transplanted hair to fall out within the first few weeks, but don't worry, that's a normal part of the process. The new hair will typically begin growing back within a few months. Most patients can return to work after a few days, but it's advised to avoid strenuous activities for a couple of weeks to allow for proper healing. The results of a hair transplant aren't immediate. While you may notice some hair growth within a few months, it usually takes about 6 to 12 months to see noticeable improvements. Full results are typically visible after a year or more. Once the transplanted hair starts growing, it is permanent, and it will continue to grow naturally. However, if you have ongoing hair loss in untreated areas, you may eventually need additional procedures. It's important to manage expectations and be aware of the potential risks. Although the surgery is generally safe, there are some side effects to consider, including the possibility of infection, scarring, or unnatural results. The quality of the outcome largely depends on the surgeon's expertise and the technique used, so it's essential to choose a skilled, experienced professional. Cost is another factor to keep in mind. Hair transplants can be expensive, with prices ranging from $4,000 to $15,000 or more, depending on factors such as the technique used, the surgeon's reputation, and the number of grafts needed. Keep in mind that most health insurance plans do not cover hair transplants, as they are considered a cosmetic procedure. While hair transplants are a popular and effective solution for hair loss, there are alternative treatments available. Medications like finasteride, Propecia, and minoxidil, Rogaine, may help slow hair loss and promote regrowth. Additionally, PRP, platelet-rich plasma therapy, which involves injecting your own blood plasma into the scalp to stimulate hair follicles, is gaining popularity as a non-surgical option. Wigs and hairpieces are another alternative for those who prefer a non-invasive approach. If you decide to pursue a hair transplant, make sure you choose a reputable surgeon with a track record of successful procedures. During your consultation, ask to see before and after photos of their past patients and make sure you feel comfortable with their approach. With the right care and expertise, A hair transplant can provide you with natural-looking, permanent results that transform your appearance and boost your confidence. In the end, hair transplant surgery is a significant decision, and it's important to carefully weigh all the factors involved. By doing your research and working with a skilled professional, you can make the right choice and enjoy the benefits of a fuller, more youthful head of hair. Thanks so much for watching. If you found this video helpful, please make sure to give it a thumbs up. It really helps support the channel and lets me know you want more content like this.